after being diagnosed with rheumatoid arthritis, now I was put on medication. I can't remember because that was in 2007. So but I was put on some medications. But then my life changed almost instantly because now there are things I couldn't do, like washing my clothes, mopping because I used to live outside campus. So even washing my own room, washing my clothes, I couldn't do that. So I had to outsource the mama fua, who would come maybe once a week or twice a week to do the work for me because I couldn't do it. I would develop things like nodules, Then they would swell, they become reddish and swollen and very, very painful to touch. And when they would heal, they leave marks, scars. I actually even have the scars to date on the legs.
So usually when we look at the signs of the disease, we have people get aggressive from the beginning, and girls will get like something slow and controlled. So maybe she may be on that particular part of the slow and control, but I think for her, slow and control is a relative, isn't it? But I think for her, the take-home message is that she took her medicine. She was regular with her clinics, and as you can see, if we are more consistent like that, the outcomes are normally good.
Hello and welcome to another episode of Behind the Diagnosis. I am your host, Esther Ashira, and with me is our sign language interpreter, Judy Kihumba. Thank you for always tuning in, and if you're joining us for the first time, karibu sana. Today we are focusing on a condition many people know very little about, yet thousands silently live with: Sjogren. To get us started, let's hear from Dr. Eugene what it really is.
So Sjogren is autoimmune. How does it present? It presents typically with joint pain. There's fatigue. Sometimes they get dryness of the mouth, dryness of the eyes, amongst many other symptoms. Sometimes they get numbness of the legs, and in very extreme cases they get chest complications. So more commonly, it's amongst ladies. We suspect the X chromosome might play a role there. In terms of diagnosis, it's a very difficult one to diagnose, to be honest. Most studies report 2 to 5 years before the diagnosis is made.
Thank you, Daktari. We'll come back to you shortly to explore treatment and long-term management. But first, let's hear from the lady behind the diagnosis, who lives with not just one, but 3 autoimmune conditions: Sjogren, Lupus, and Rheumatoid Arthritis. Karibu sana, Annette.
Thank you so much. Thank you for having me.
Karibu. I would like you to introduce yourself to us.
Okay, thank you. My name is Annette Nyakora, a mother to 2 wonderful boys, a wife to 1, and also by profession, I'm an advocate of the High Court of Kenya, and I serve as a state counsel with the AG's office, currently attached to the Ministry of ICT.
Wow, thank you. Wonderful. Thank you. So tell us, before diagnosis, who was Annette?
Annette grew up just like any normal young girl, enjoying a healthy life up until when I joined university. So before diagnosis, I was just like any normal young lady going on about her activities until diagnosis in 2007 when I was diagnosed with rheumatoid arthritis. When I was in campus, I think I was in the second year of campus. That's when I was diagnosed with the rheumatoid arthritis.
Okay, so before we go deeper into your condition, you said you are a normal child. Were you in any sports?
Yeah, actually I played, this is funny, I played soccer in high school. I also played hockey. I was in the school team playing hockey and also soccer for the school. Yes.
Interesting.
Yes.
You still do?
Now I watch. I don't play. I don't have the energy to play the football and so with age also I no longer take part in the sport, but I'm a fanatic. I'm a football fan. I support Manchester United.
Oh,
yes.
Really? Let me not talk about Manchester. Some people might not watch this show. Okay, and then rheumatoid arthritis. Yeah. So what was the first symptoms, or what took you to hospital?
Okay, back in the day, sometimes I would wake up it started with basically joint pains. I would feel pain on my arms and my knees. And because I didn't know about arthritis at the time, I thought it's just normal, body aches. And I would go and buy painkillers over the counter. But until one day, I felt so much pain in the night. When I woke up, I couldn't walk. Walking was a problem. I decided to go to hospital. So I went to Moi University because that's where I studied. I was in Moi University. So I woke up and went to Moi University Hospital. And so the doctor, when I explained how I was feeling, the doctor just said, those are normal pains. But I insisted. I was like, this pain has been there for some time. And I think it's good that we have a look and, see what could be the problem, because I was in constant pain. So for me to have woken up and actually gone to hospital, I was in extreme pain. So that is when the doctor decided to, based on the symptoms I had told him, decided to do a test for rheumatoid arthritis. I don't know whether they call it RA or something like that. And it came out positive. So that was the first time I had, even the word rheumatoid arthritis. So the first thing I did, I called my mom then, and I explained to her, I told her, Mom, I've not been feeling well, and I'm just from the hospital, and I've been told that I have rheumatoid arthritis. Now, she was like most people know, now I'm in campus, so I'm probably 1920. So she tells me, but rheumatoid ni ugonjwa ya watu wazee. So she's like, you need to get a second opinion, like other tests. So when we closed school, came to Nairobi, went to Kenyatta, did tests for rheumatoid. They turned out positive. So then we confirmed that I actually had rheumatoid arthritis. Wow. Yeah.
Your story is kind of different from what I've had before, because you felt something different in your body.
Yeah.
And that was the first visit?
Yeah, that was the first visit that I had actually gone to find out what was wrong with, because I was in pain.
Yeah.
So when the doctor told me they were just normal pains, I said, no. They're just not normal pains, because I had been taking painkillers. So I will take the pain subsides, but then it comes back. So I thought that we must get to the bottom of it, because this pain must be coming from somewhere. So now that is when the doctor decided to carry out the test for rheumatoid arthritis, and it came out positive.
That was a very fast diagnosis.
Yes, it
as compared to many people who diagnosis takes long. Does it mean that you are so persistent?
Yes.
If you are not persistent, will it have happened the same?
No, I don't think so. Okay. So I think listening to my body over time, I knew that something was wrong that needed to be addressed. Yeah.
So after now you have rheumatoid arthritis, what's going to your mind?
So now after being diagnosed with rheumatoid arthritis, now I was put on medication. I can't remember because that was in 2007. So but I was put on some medications. But then my life changed almost instantly, because now there are things I couldn't do, like washing my clothes, mopping because I used to live outside campus. So even washing my own room, washing my clothes, I couldn't do that. So I had to outsource the mama fua, who would come maybe once a week or twice a week to do the work for me, because I couldn't do it. Yeah.
Wow.
So now, so I lived with rheumatoid arthritis. So at some point it went into remission. Remission is where now it doesn't show. I was no longer in pain so many years. So it came back. Now I started having now symptoms again in 2019. So now in 2019, started having again severe, body pain, body aches, and I started swelling on the legs. I would develop things like nodules, Then they would swell, they become reddish and swollen and very, very painful to touch. And when they would heal, they leave marks, scars. I actually even have the scars to date on the legs. And then other than that, I also had frequent headaches that would just come from nowhere, and extreme fatigue. So at the time I used to live in Feather and worked in Sheria House. But walking from Sheria House to Ambassador, where I used to take my bus home, was a problem. I couldn't walk even 100 meters without getting tired. So I would, most days I would use an Uber to go home, and also from home to work. Waking up had become a task. Everything now sounded like everything was a task. Extreme fatigue, normal activities, doing normal activities became such a task, So it was not until I started having those frequent headaches and the extreme fatigue. What caught me was the extreme fatigue, because I would sleep tired, wake up tired, always. So this particular time, so I didn't know what condition it was. I went to Mpisha. So when I went to Mpisha, I saw the doctor there. I explained to him my condition, and he was like, from what you're telling me, I think what you have is more than just rheumatoid arthritis. But he told me, since I am not a specialist in that area, I'd like to refer you to, he mentioned some doctors that you go see, and then they take this particular test. So he told me which tests to take. So I went to Nairobi Hospital. So Dr. Simani ran the tests. Turns out positive for lupus. So now you can imagine you're hearing that you have lupus. This is such a big word. So other than being told I have lupus, the only other time I had heard about lupus was some lady who had passed on years before who had lupus. So this was the second person, hearing of somebody who has lupus. The second person was myself. So I shared my diagnosis with my best friend, and she was like, that is such a serious condition. You need to get a second opinion. So I dilly-dallied with it because I was weighing in my head. It's such a big and serious condition. So, but then I said, even if I dilly-dally, I'll have to confirm this even if it's 3 months down the line, 2 months down the line. So I went for another opinion, a second opinion. Again, positive for lupus. So now I knew, now I have two. I have rheumatoid arthritis, I have lupus. So now, the next appointment I had with my doctor, he realized I had a dry mouth. So he asked me, do you normally suffer from a dry mouth? Then I was like, yeah, I have a dry mouth, and sometimes I feel sand in my eye, something like sand in my eye. He was like, I think you have Sjogren's syndrome as well. So, and then I realized also, I hadn't known that was what was happening to me, because I had frequent infections of the parotid gland, the salivary gland. So when I told him that, he said that is the reason, because now the body doesn't produce enough saliva. So the little that is produced is very thick, and so it doesn't flow freely. So it blocks the glands. So they become inflamed. That is how you get inflammation of the parotid gland that brings the part. Yeah, so to manage that, I think he prescribed some medication which I still take for that, for production of saliva and tears.
Wow, yeah. So for you to have saliva,
I have to take the yes, something we take for granted, something like saliva. I have to take medication for my body to produce saliva. This is not cheap. The medication is not cheap.
Like you take medication to produce saliva?
Yes. And tears.
What happens if you don't take?
So if you don't take, you have a dry mouth. So the mouth becomes dry. It's very dry. And also your body doesn't produce tears. So the eyes are not well lubricated. They become itchy, red. And it's funny. Someone once joked, because they didn't know I had the problem with the dry eyes and the dry mouth. Somebody once said, he was asking it in a joking way, why are your eyes always red? So I tell them they are red because I'm sick. But it's like, I always assume you must smoke something before you come to the office. So I was like, no, it's not that. It's a condition.
The things we assume.
Yeah.
Wow. Well, how has it been?
With medication, it's been good. Yeah, other than that, I wouldn't do it without the medication, because that means that I'm constantly inflamed or have infections of the parotid gland. Yes.
So you're taking 3 medications.
Yes, actually, okay. So I'm taking for the one for the production of saliva and the tears. I also take artificial tears. Eye drops, artificial tears. Yes, and also take hydroxychloroquine. We call them HCQs, and also take Imuran, which they call azithromycin, something like that. Yeah.
Okay. Yeah. I know Doctor will help us.
Yes.
On those terms.
Yes.
But I'm just looking at you and I'm like, yeah, the truth of the matter, I don't know if you've ever been told that you actually don't look what you're saying.
I know, and that is the thing. My lupus didn't present with the normal, most lupus people identify with, there's what they call the butterfly rash, but I don't have the typical butterfly rash. You understand? So that is why somebody would assume I do not have lupus, but it is there. I may not have the butterfly rash, but I have all the other symptoms.
But even for arthritis.
Yeah. Now for this, I think it is constant medication, because I'm always on medication. I never miss my medication. That has really helped, because once I take the medication, the fatigue goes down and also the pain. So I used to take painkillers a lot, but the doctor advised me against it because of the side effect it has with the liver and the kidneys. So now sometimes, unless the pain is really, because sometimes it can be overbearing, that is when that is when I take the painkillers. But mostly I just do my HCQs and the rest.
Wow.
Yeah, the ones I've mentioned.
So for you, what stands out or what comes different is you had early diagnosis.
Yes.
And your medication.
Yes.
Like you do it frequently.
Yes, I do it frequently. Yes. So I have to get monthly refills. Yes, that has really helped a lot with the diagnosis. You look at my hands, they're not deformed. Yeah, it's just the frequent maybe joint pains and, knees and joints here, but my hands are okay.
Because I'm surprised because you've had it since 2000.
Yes, since 2007.
Wow, that's interesting.
It's 18 years.
Mm-hmm. And it's also something that many people can learn.
Yes, yeah.
Probably because of the frequent taking of medication.
Yeah.
I know you're working.
Yes, I am working. Oh dear. Yes.
And there are people who have been diagnosed or they have maybe even just one autoimmune disease, but you cannot afford. So for you also, another thing is the cover. I'm sure you have a medical cover.
Yes. Okay. Yes, I do.
And that helps a lot.
That helps a lot. Okay. As a civil servant, we have the comprehensive medical cover for civil servants. So there's a problem during the transition from NHIF to SHA. We really suffered because then hospitals were not giving or taking the SHA cover, and we had to, get treatment out of pocket. And treatment for lupus and these other conditions is very expensive. So we suffered for that. But right now, I can say that I'm able to get my medication with my insurance cover. Yes.
Wow. So you work normally?
I do work, but that doesn't mean that there are no challenges. Yes, I do work. I work. And I work in a busy environment. So I still have the normal, the normal challenges that come with having lupus, especially when there are, morning meetings and you have to wake up early, to attend early morning meetings. Waking up is a problem. And also another challenge is concentration. So I don't know, it's because of my concentration span is very short, and also I'm very forgetful. So in my work, and because of the kind of work I do, so for me not to forget things, I have to keep, writing things down and something like that. Yeah.
Wow. So what has this journey taught you about life?
It has taught me that, times and things change in life, because never in a million years did I think that I'd have lupus. You understand? Or any of these autoimmune conditions that I have. You never want to be told you have some conditions because they are serious conditions. So I've also learned that you have to be resilient and also be positive, because that is what has helped me. Being positive, knowing that I have autoimmune conditions, 3 of them, but I cannot tell myself, or I cannot afford to give up, because giving up would mean that now the conditions come and attack me. So positivity, having a positive mindset, and also accepting what you cannot change. These are autoimmune conditions which are lifelong. So you just learn how to live with them and manage them well.
Wow.
Yeah.
I have talked to you just once on phone.
Yeah.
The other times we were chatting.
Yeah.
And girl, you're such a vibe.
Thank you.
You're such a vibe.
Thank you.
The positivity. I don't know what drives you. What drives you?
I'd say honestly, I get encouragement from the Word of God also, and also I get a lot of support from my family, because now my family, I live with a family, they've had to adapt with time, knowing mommy can't do this, my wife can't do this. So I live a quite a comfortable life, because what I can't do, I have people in my family who do it without even complaining, because that as they know I can't do it. So if it's things to do with mopping the house or this, I just do things that don't require a lot of bending and a lot of, hand movements or leg movements that I do. So I've really gotten a lot of support from my family, from my husband, and also from my friends as well.
Wow. Yeah, that's beautiful. And we thank God for your family.
Thank you.
Are you in any support group?
Yes, I am in a support group. There's a support group on Facebook. No, not on Facebook, on WhatsApp. Sorry. How I came to join that group, it's a funny story. So after being diagnosed with lupus in 2019, this day I was walking in town. Then I saw somebody who wearing a t-shirt with Lupus Foundation, Lupus Foundation. So I approached the lady. I'm like, hi, my name is Annette, and I'm seeing you wearing a t-shirt written Lupus Foundation. So I tell her I was recently diagnosed with lupus, and what's this about? So she's like, yeah, there's a foundation. We're even on WhatsApp. So I told her to introduce me, and I was introduced. And so we are in a group, many of us with different autoimmune conditions. So we share our stories, and we call ourselves warriors, because we are warriors, because what we are fighting is tough. Yes.
And does it help?
It does help. It does help a lot, because then you get to see that you're not the only person that is, fighting these conditions. So there are people whose, condition is more severe than mine. There are those who, some I've seen people even being helped. Some people do not have medication, and members of the group are here to help them with getting medication. And sometimes we lose people in the group. So members come together and at least contribute something to their families. Yes.
Do you know of anyone else who has Sjogren?
Funny enough, no. Other than some people in the group, I've not met anybody else who has Sjogren's. Perhaps there are people who have it, but they don't know that it is actually a condition. And now what I did, because I will get, the mouth becomes so dry that you look like you've not eaten food for days. So this is what I used to cover up. You understand? That's how I started applying lipstick to cover up the dry mouth. Because even when you apply the lip gloss, and it still shows that the mouth is quite dry. That's how I ended up doing.
And swallowing, is it a challenge? Because surely not having saliva.
Yeah, so but now when you eat food, the food has some, what is it called? The food has some what do we call it? Yeah, some liquid or something will just flow. But it's just the normal now. When you keep quiet, your mouth becomes so dry. Like right now, nasikia imekauka.
Mama, naweza tema mate.
Iko wapi ya kutema hii?
Anyway, so how is the medication you're using? Pills? How expensive is it?
It is very expensive. Okay, one tablet, where I get it from, a tablet costs 300 bob. And it is 3 times a day. So if you're taking 300 per tablet, that's like 900 a day. You're not putting the other medication. But that one is the most expensive of all the drugs. The one for just producing saliva and tears, that's the most expensive drug that I'm taking. So that's 900 shillings a day. You times a month, you 30 times, it's 27,000 for production of saliva and tears. Yes.
Wow.
I know.
What would you tell, or what would you want someone to understand, anyone who has autoimmune disease?
One is having an autoimmune condition is not the end of life. I'm here. So what I will tell them, first of all, for anyone, even a person who's not been diagnosed, let me start with those who have not been diagnosed. It's always good to listen to your body. If today you feel like there's something that is off with your body, you can always know when something is off. Always have it checked. Let's avoid this notion we have anything and everything over the counter, painkillers and things like that. That is how you will end up. The disease progresses without your knowledge. By the time you're getting the correct diagnosis, the disease has already progressed too. So it is good that conditions are caught early and management starts early. So anyone that has lupus or any other autoimmune conditions, be positive and always make sure that you take the medication. That is very important because that is how I've managed to come this far. Yes.
Wow. That is to now the warriors of the session.
Yes.
But now there are other people who probably know someone with an autoimmune disease, or because the people who sometimes feel people are either mean or they don't understand, or they can just say a statement that will probably hurt someone. And we live with the warriors amongst us.
Yeah.
What would be your word?
Yeah, my word would be learn to be supportive of people with autoimmune conditions, because we are mistaken for being lazy. Because when you're fatigued, you're tired, you don't feel like doing anything. So it's not being lazy. It's just that you're sick. And this is a sickness that doesn't show. It is what you're feeling on the inside. It doesn't show. It's not like I have a wound or a scar somewhere that somebody is going to see and see for sure you're sick. So for autoimmune conditions, most of them don't show. But what is happening within the body of the patient. So let's learn to be tolerant of people and also be a little more knowledgeable. When somebody tells you they have, before you go judging, ulipata, there are very many myths concerning these autoimmune conditions. Also learn about a thing or two about a certain condition, and let's not, pass judgment to people suffering from autoimmune conditions. And if you have a relative that is sick, suffering from an autoimmune condition, support. Nothing beats the support you get from family and friends. Yes.
Wow. I honestly don't even know what to say. Like, you are such an encouragement. Thank you. You are such a strong person. Thank you. And I pray that this doesn't stop.
No, it won't.
Yeah,
it won't stop.
Keep going. And if you find someone, please encourage them. Because there are people who might not have the courage and the strength that you have and God has given you. And I am sure even those who are watching today, there is someone who probably has one and they feel their life is crushed, but today they're encouraged because they're like, wow, and she has 3. Yes, and she is positive like this. That's why we're here, to just bring hope and encourage everyone and know that they are not alone.
No, they're not alone.
Thank you so much for coming.
Thank you.
Thank you for sharing your story.
Thank you.
You're amazing.
Thank you for having me. And let's spread the love to our warriors.
Awesome. Awesome. Okay. Now let's bring Dr. Eugene back to help us understand more from the medical side.
I don't ever slow up, no I don't take shit. I got no love for the fakeness. If you wanna play tough and wanna hate this, I'll always show up. I don't ever slow up, no I don't take shit. I got no love for the fakeness. If you wanna play tough and wanna hate this, I'll always show up and make a statement. I don't ever slow up, no I don't take shit.
always show up and make a statement. Everything I do so instinctive.
Welcome back, and thank you for staying with us. I'm sure you heard Annette's story, and now we're joined by Dr. Eugene, who will help us understand deeper on how living with these three conditions is. Karibu.
Thank you for having me. My name is Dr. Eugene. I'm a rheumatologist. A very interesting talk. I've listened to Annette's story. The first thing is that she has a myriad of diseases. There's lupus, there's rheumatoid, and the Sjogren. So you collectively call it as mixed connective tissue disease. So the science is as with all autoimmune diseases, whereby the body's immune system mistakenly attacks you rather than protecting. And the challenge is that it can present with symptoms for lupus, symptoms for rheumatoid arthritis, and symptoms for what? For Sjogren's. So as for today's talk is more on Sjogren's. So I think I dwell more on the Sjogren side. So Sjogren's is autoimmune. How does it present? It presents typically with joint pain, there's fatigue. Sometimes they get dryness of the mouth, dryness of the eyes, amongst many other symptoms. Sometimes they get so numbness of the legs, and in very extreme cases they get chest complications. So more commonly, it's amongst ladies. We suspect the X chromosome might play a role there. In terms of diagnosis, it's a very difficult one to diagnose, to be honest. Most studies report 2 to 5 years before the diagnosis is made. And you can see from Annette's story, her story is actually a long one. Started with rheumatoid, then went to lupus, then eventually ended with what? Sjogren, as you can see. And partly because the symptoms can be very non-specific. So maybe when can you suspect that probably Sjogren might be there? And number one, dryness of the mouth. Number two, still in the mouth, a lot of tooth issues, dental caries, toothaches and everything, recurrent. No must think that probably something is going on there. Number three, dryness of the eyes. You've been on the eye drops for a long time. You've been told the eyes are dry. Then I said, doctor, okay, what could be causing the dryness of the eyes? Rather give me what? The eye drops. Joint pain is another common presentation. Unexplained numbness, fever, and fatigue. Fatigue is one of the most common symptoms that our patients normally are faced with. Yes.
Wow. So for her, do you think there's a connection between Sjogren and the other two conditions?
Yes, there is, because Sjogren's we divide into two. We have primary and we have secondary. So primary comes in isolation. That's a very difficult to diagnose because the duration symptoms are very vague here, there. But secondary comes the background of another illness. Commonly, it causes rheumatoid arthritis, number one. Number two is lupus. So there's an association between the two.
So we've been here with you with a number of warriors, and there's something different about Annette's diagnosis. Like her first visit, and she got a diagnosis. What do you think is the difference between her and maybe the rest of the people who probably we haven't even had a conversation with?
Mm-hmm. I think her persistence. Sometimes we like shortcuts in Kenya, whereby by twice paining, painkiller, go home, and we're happy with that. It disappears for a few weeks, a few months, it comes back again. I think her persistence helped. Number two, I think her being in Eldoret has a university there. So that might also have raised awareness because some of these illnesses are not that common, and it has been an education, a teaching facility. So I'm sure that I must have picked up something there. But what I like about her story is that from her story is only about the early diagnosis part. The fact that despite the diagnosis, she's been constantly taking her medicines. And you can see she's living almost a full life, which we want for most of our patients.
Yeah, because for me, if you tell me you have arthritis, the first thing my eyes would go to are the joints. But when I look at her hands, like you can't even tell.
Yes.
They are. So that is the being consistent with medication.
So so usually when we look at the science of the disease, we have people get aggressive from the beginning, and girls will get like something slow and controlled. So maybe she may be on that particular part of the slow control, but I think for her, slow control is a relative, isn't it? But I think for her, the take-home message is that she took her medicine. She was regular with the clinics, and as you can see, if we are more consistent like that, the outcomes are normally good. Because if you look at the data, the old data from before, a lot of patients have complications, death, deformed joints and everything. And that was because you start today, stop, disappear, come back, day, stop. When the old data had said about 40, look like for example, rheumatoid arthritis, about 40% lose, stop working after 5 to 10 years of diagnosis. But like I say, for her, from 07 to now is almost 15 years, and she's working well and everything. So I think for her, I think it's an encouraging story for our patients that we stop looking for shortcuts, just follow the instructions from the doctor. I think also have commend Dr. Simani. I think Dr. Simani has done a good job with that also. But sometimes we say the patient forget about the doctor, and the doctor also did a good job with that. Yes.
Yeah. And also something else, because we might say maybe other people don't want, and I'm sure there's no one who want to be unwell, and yet there is medication. How economical is the medication for also arthritis?
Arthritis is expensive. But what I tell my patients is that do you want a cheaper short-term solution that will not get you anywhere? And then in the long run, the complications set in, you can't work. We have to start only about very expensive medicines. Like some medicine, there's one called rituximab that goes for about 180 to 200,000 shillings per dose. Or do you just want to start just nicely with these normal conventional medicines, the azathioprine, the methotrexate, the reflunomide, and in the long run, you have a more productive life away from the hospital and you save more money. So sometimes cheap can be expensive. And for our patients, I think the biggest problem we have is that they expect to be well tomorrow. Unfortunately, the medicines take time to start working. On average, once you start, for example, like the azathioprine issues or methotrexate, will take about 3 months to start working. As the rest patients, that 3 months don't have the patience. They want a quick acting solution. But also, if you see if she's had the disease for 2007 and then in 2025, that's a long period. And most people cannot understand how I can take medicine for that long. And it's not diabetes, it's not hypertension. Those people in their head are known as a long-term disease. Yes. Oh.
Now, it's true, cheap can be expensive, but what if cheap is all that you have?
It's tough. Yeah, it's tough. It's tough. But I think right now, if you look at the market right now, we have generics. A lot of our medicines come from India, Bangladesh, Pakistan, and the generics have helped. And that's what's flooded the market now. So the prices are relatively cheaper. I remember like when I used to work for our boss, Professor Oyo, he used to tell me that before some of these drugs entered the market, it was a challenge. And when they came, the price was very high. But the land that is on demand, the prices did what? Came down. So I think at the end of the day, things where you get the medicine. I think right now places like Kenyatta, you can get them subsidized, isn't it? Because they have a different pricing. I think Boy has a different pricing. And people are a bit more competitive now. Yes.
Wow. So for going back to Sjogren, how many patients do you see who has Sjogren? Or how many times have you diagnosed that? Because honestly, we have never had.
So it's not that common. I can't say the numbers at the top of my head, but it's not that common. It's not that common. Partly because we don't look for it. But like I said, we have the isolated who are very, very rare, not that common. Most of the patients come in the secondary, meaning they have either rheumatoid or lupus, and Sjogren is in the background. But isolated, not that common. The ones who I've seen, most of them actually have lung issues. Because the Sjogren can actually cause damage to the lung, some inflammation, so they have been oxygen and very, very expensive medicines. So but imagine those cases have come at the end. You get others, like I said, most of them primary or secondary, meaning in the background of rheumatoid or the background of lupus.
So that means it's easy to diagnose it if there is another underlying condition.
It's tough because imagine like for her probably she might have had it for a long time, and I think the doctor didn't ask for it. She might have thought it's just normal. So over time, our modes of diagnosis has gotten better, but to be honest, it's a very difficult disease to diagnose. But there have been some seminars where the profs say can take up to 10 years in Europe to get the diagnosis of what? Of Sjogren's, because the symptoms are very vague. Because think about it, Today you have a subjoint pain disappears. Dries your mouth, say, maybe I didn't take water yesterday, I'm thirsty. And my eyes, they always itchy. Goes to the doctor, allergies. That's the first thing there. They think, numbness, maybe I sat badly. So you can see it's something that is very vague. And putting the picture together may take some time because the symptoms that don't come at a go is something that sometimes may progress over time.
Wow, that's interesting. And I'm sure someone somewhere, probably they have the symptoms, but now they know what to do. Yeah, they know they need to, like, it's not a normal thing. What I will tell someone is don't wait until it's too late. Yeah, so that you can get help.
As early as
starting. Yes. Thank you for always coming.
Thank
You have been such a blessing on this show.
Terrible. Thanks.
You have been such a blessing on this show, and many people are asking. Actually, when you, in every episode you're in, everyone is asking, where can we find?
So I'm not teaching, I'm at my office at KMA Center. Napa. Yes. Yeah.
Liberty Arthritis Clinic. So yeah, they can find you, and they will find help. Thank you for helping out even on those patients or warriors with autoimmune diseases.
Thank you.
God bless you so much.
Thank you.
Wow. What can we say? Annette, thank you for opening your life to us. And for you, Daktari, your insights help so many people understand what rarely gets talked about. And to you watching, and you are or know someone whose story needs to be heard, please reach us on 0701 300 799. I am Esther Ashira, and with me is Judy Kihumba, our sign language interpreter. This has been Behind the Diagnosis, and please subscribe to our channel and follow us on all our social media pages. Let's keep learning, supporting, and speaking up. See you on the next episode. And remember, every story matters and every voice deserves to be heard.